am a member of the League of Women Voters of Lafayette. Since 1920, the League of Women Voters has worked to educate and inform voters. The League is nonpartisan and it is nonprofit. It does not support or endorse any candidates or their parties. It's open to men and women from the age of 18. The Lafayette League encourages informed and active participation in government, works to increase the understanding of major policy issues, and influences public policy through education and advocacy. We welcome you tonight to the League's event, the Forecast for Healthcare in Acadiana. We are pleased you could join us for what we hope will be an informative and rigorous discussion on an issue that affects every single one of us, healthcare. Addressing the shortcomings in healthcare policy in Louisiana is critical. Louisiana lags behind the U.S. in infant health, life expectancy, and insured rates. Prior to Medicaid expansion, Louisiana had an uninsured rate of 21%. With that expansion, that percentage has dropped to 11%. But remaining uncertainties in federal policy, partisan disagreement, the impact of poverty has led us to this conversation tonight. What is the status of healthcare reform? And what can we do, or what do we need to know to make an effective healthcare delivery system for our state? We are grateful to have a very knowledgeable panel with us tonight. Joining us from the far left is Katie Hebert. Ms. Hebert is the Chief Executive Officer for University Hospitals and Clinics and has been with Lafayette General Health since 2007. Prior to this position, she served as administrator of Lafayette General Surgical Hospital and later the CEO of St. Martin Hospital. Thank you, Ms. Hebert, for joining us. Next, we have Ms. Linda Hawkins. Linda Hawkins joins us from the St. Tammany League of Women Voters and has led healthcare advocacy efforts on our behalf with the League of Women Voters here in Louisiana. Among these efforts, she serves as a commissioner rep with the Department of Insurance and Louisiana Healthcare Commission. She also participates nationally on the League of Women Voters in the U.S. for healthcare reform. Mr. Brian Burton is the Director for Health Interventions at Southwest Louisiana Health Education Center, a nonprofit health foundation with offices in Lake Charles and Lafayette. He serves as the principal investigator on a number of public health projects. In recent years, he has focused much time facilitating the implementation of the Affordable Care Act through Healthy Louisiana, a project of Louisiana Enrollment and Partnership. Mr. Dustin Miller was supposed to join us tonight. You know the legislature is still in session and they're busy. Hopefully he can run in for a second to answer some questions for us. During tonight's program, we have questions prepared for each panel member to answer. We will give panelists 2 minutes to respond to each question, and at the end of this hour, we hope to have 20 to 30 minutes for questions from you, our audience. We also want to thank the AOC Community Media for recording tonight's event. The event will be available for viewing and for sharing within a few weeks. Thank you, panelists, for joining us. We're going to get to our first question, which is essentially to introduce yourself as a panelist and what position your organization plays and how does it represent healthcare delivery in Louisiana. So Ryan, we're going to ask you, explain your role and activities in healthcare delivery in Acadiana or Louisiana.
Thank you, Jermaine. First of all, I'd like to thank you for taking the time to come this evening, and also the League of Women Voters for Lafayette, Acadiana, for having me. My name is Brian Burton. As Jermaine said, I am the Health Interventions Director for Southwest Louisiana Area Health Education Center, a public health foundation. Offices in Lake Charles and Lafayette. Early 2013, as the Affordable Health Care Act was about to enroll out, we looked at the new law as, we have a long history of being able to provide community outreach and helping folks understand very difficult health concepts. And we knew that there was going to be a challenging with understanding the new law. And so we applied and we were awarded the statewide contract from the federal government, from the Centers for Medicare and Centers for Medicaid and Medicare Services, to serve as the statewide navigator entity. So us, along with the other two area health education centers around the state, created a consortium called Navigators for Healthy Louisiana. And since 2003, we've been funded to be able to provide those services. So what we do is we help consumers basically understand what the Affordable Health Care Act is, how to understand how the healthcare.gov website works, and to help facilitate those plans. Our biggest challenge over the first 2 years were the number of folks that were below 100% of the federal poverty level and just had access to no problems. I mean, had access to no insurance. And so it also, in the early 2016, when Governor John Bell Edwards announced that we were going to expand Medicaid, our role was to organize organizations around the state and to help folks enroll in Medicaid.
Thank you, Mr. Burton. Ms. Hawkins, our member and friend, thank you for being here. Explain your role and your activities in healthcare delivery in Acadiana and Louisiana.
Do I need to?
You can press the mute button, it should come on. Press it down and hold.
Thank you for having me. And
Thank you for having me. This is great. My name is Linda Hawkins, like she said. I do live in Abita Springs, Louisiana. I am the state rep for the League of Women Voters. My local league is St. Tammany, but I travel the state. The League of Women Voters, I think if I could ask Jermaine to kind of advance it to what the League of Women Voters position is. It was established in 1993, and from the national perspective. It was adopted after much study. The study was a 2-year study. The League, you may or may not know, studies positions before we make a decision. And so, unlike some of the issues that we'll be dealing with today, we do look at the background. But we, from the position that is adopted, it's a basic level of quality health care at an affordable act, nationally financed through general taxes or employer-based. Opposes strictly private market-based financing models solely administered by the private sector. But we do agree with partnerships, but not totally. I knew you'd be looking. Combination of private and public. Healthcare resources are going to be based on urgency of the medical condition, patient life expectancy, expected outcomes of treatment, cost of procedure, duration of care, quality of life issues, and wishes of the patient, not on the ability of the patient to pay. She's giving me the fingers.
3 fingers.
3 fingers.
Thank you, Ms. Linda. Ms. Abair is here from the hospitals. Can you explain your role and activities in healthcare delivery in Acadiana?
I sure
and
can.
Louisiana?
Thank you for having me. As the CEO of University Hospital and Clinics, we are one of the public-private partners in the state. As you may or may not know, in 2013, Governor Jindal at the time decided that the state of Louisiana should get out of the healthcare business. So we embarked upon several public-private partnerships. University Hospital and Clinics used to be UMC, if you recall. At our hospital, we also have a graduate medical education. We train residents as well as take care of the patients within Acadiana. And so we are part of the public-private partnerships, and we work every year and in the special sessions to explain the things that we're doing in Acadiana for our patients and educating our residents at UHC.
Thank you so much, panelists. We have some handouts in the back. Make sure you get them. There's a colorful one that Brian brought in. It's how ACA impacts healthcare in Acadiana. Make sure you have that one. Linda had some really good handouts also for our legislators in the area, because a lot of us don't remember who our legislators are. That's just to help us to remember, and which bills the league is following. So you have all of that information here with you, and she's going to explain some more information that she's brought along with us. Now we'll start again, Ms. Hebert, with you. Our next question is, how is your organization affected by, or how does it affect the financing of healthcare in Louisiana?
Well, it's a twofold answer. The first is we are part, as a public-private partner, our arrangement with the state is funded through the Louisiana Department of Health. The Louisiana Department of Health is part of the state general fund. And so, as you know, we're in a state budget crisis. The two things that can be cut in the state budget are higher education and health care. So we're always on the chopping block. So that affects us in that way. But we also contribute to the state general fund. Part of our arrangement with the state is, and I'll use UHC as an example, the building that we have our hospital in is a state building. We pay the state, we lease that building to the state. Several of the other organizations throughout the state, the other hospital entities, also make lease payments to the state. We also pay, we pay for the physician, the LSU faculty. We pay the state for the faculty that reside at UHC. All those dollars that we pay the state, they're able to draw down federal money. So where we pay those dollars, the state was able to draw matching funds. In the course of from 2013 to 2016, in the 3 years, our relationship with the state brought in $2.7 million to the state. So we contribute, but we also are part of the cuts as well.
Very interesting. I didn't know that you actually paid and then you're reimbursed or refinanced because of it.
Federal dollars.
Right. Thank you, Ms. Hebert. Ms. Linda, how is your organization affected by, or how does it affect the financing of healthcare in Louisiana?
Well, one of the core positions that we have within our healthcare position is affordability, and also the ability for us to monitor and watch how things are being financed. That's especially interesting that's happening right now, as Ketty said, you know, with the legislature. So I just finished testifying actually last week on one HB 6. In fact, thank goodness we were able to knock that one down, on the mandate. But we also look at the financing. And the financing is very important, because if you don't have the financing, you can't provide the services. So that's a core function when we start looking at our positions in defending them or opposing them or whatever we need to do.
Thank you, Ms. Linda, and thank you for working so hard for the league, being there for us, being our eyes and ears in the legislature. Brian, how is your organization affected by, or how does it affect the financing of healthcare in Louisiana?
So my organization, I think, is a little different than the others, because what we're trying to do is empower people to be able to finance their own health care. And so that is through access. And so access to health insurance. You know, if they're over 138% of the federal poverty level, we're able to help consumers and connect them with insurance companies here in their community. There are 3 through the federal marketplace right now: Blue Cross Blue Shield, Vantage, and Humana here in Lafayette and Acadiana area. And then for those that are below 138%, it is to sign them up and get them access to one of the 5 Medicaid expansion providers, or Medicaid providers in Louisiana, through an expanded eligibility process for Medicaid.
Okay, thank you, If you didn't know when I said the name of where Mr. Burton works is Swallowhead, that's what most people in Lafayette know it by. Okay, starting with you again, Mr. Burton.
Sure.
How has implementation of the Affordable Care Act changed the way health care is delivered or paid for in Louisiana?
What I can tell you is that people have had, through the Affordable Health Care Act, and there are lots of challenges, and we could talk about several of the challenges with that. You know, it's not a perfect law, but for the very first time, people have had access to health care that they control. You know, a lot of times we like to hear, they talk about government controlling health care. I think that there's one thing that you need to understand about the Affordable Health Care Act. It does three things. The first thing is that it connects you to an insurance provider in your community. That's why the very first question it asks you is, what is your zip code? The second thing it does is it makes sure that every single insurance company, that those 10 essential benefits, ambulatory care, ambulance services, prescription drug services, that all those insurance plans are exactly the same, and that all 10 of those essential benefits in there are in it. And then the third thing it does is for those people who can't afford it, it provides a monthly subsidy to help people be able to pay for it. So for me, the impact that it has is by giving people the power to control their own health care through financing mechanism called health insurance.
Great, very good. Thank you so much. Ms. Linda, how has the implementation of the Affordable Care Act changed the way health care is delivered or paid for in Louisiana?
That is very interesting because people don't think about it, but it has increased the number of jobs that are available in Louisiana. The economic impact has been tremendous. Through grants that come into the state, through the additional monies that are coming into the state, through quality assurance in the hospitals in terms of admission rates, looking at admissions and if the admissions and readmissions and reducing the readmission rate. So it's not only about providing insurance, although that is very important. The health care delivery system is being changed or was changed by it. Yes, there are some issues with it. It does focus on private insurance still, but I think you need to look at the training it's provided. It has provided additional primary care trainers through grants. I know in Bogalusa they got 3 additional primary care doctors up there through grants. They also have provided for the medical electronic record, where before we didn't have the medical electronic record. It also provided for Medicare. So within Medicare, and people don't understand this a lot, is through the ACA, Medicare then expanded preventive care. It also is closing the pharmacy donut hole in terms of drugs. So when these things go away, it's not only going to be what people continually think of as the poor. It's going to be, the elderly are going to be affected by this as well. And from Medicaid, you talked about the Medicaid, 75% of all Medicaid money coming into the states goes to nursing homes. It does not go to anyone else, okay? 75% go to nursing homes to care for folks that live in Louisiana.
Thank you so much, Ms. Linda, for clearing that up. That's some very good information. So Brian said from his perspective, it gives us a choice. It gives us control over our insurance. And Ms. Linda explained about how much more jobs and opportunities there are for health care. Ms. Hebert, how has implementation of the Affordable Care Act changed the way health care is delivered or paid for in Louisiana from your perspective?
So with the Affordable Care Act, brought in requirements for hospitals and providers, as you mentioned, the quality. We are, you may have heard the term pay for performance. And so with hospitals now, we did the EMR, electronic medical record, that hospitals now, most hospitals now have. We did get reimbursed through the government for those medical records, for the implementation of the medical records. Now, the way the Affordable Care Act works is that after a period of time, you get penalized if you don't have one. So if you should have gotten paid $1 for a service, if you don't have the medical record, they're going to deduct 20%. I don't know if that's the exact percentage, but I'm just giving you an example. The same holds true for the quality metrics. The 30-day readmission that you mentioned, some of the wellness initiatives, they're looking at physicians to make sure that they are ordering an annual mammogram on a female. They're making sure that if a patient comes into the office and they smoke, that they get education on smoking. We also have to report on the patient's perception of care. If you've been to the doctor or the hospital lately, you probably got a survey. And that's why, because we are bound to survey our patients to determine what they think about the care that was provided to them. If you have a low score in time, you will your reimbursement will be deducted, and you won't do as well as you normally would. So the government is not just going to pay us to provide a service; we have to provide a good service, or else we'll get penalized for it.
Sounds very interesting. It sounds like it's putting the patient in the driver's seat. That's what it sounds like to me, which is a good thing for healthcare. Okay, Ms. Aber, what are the advantages or challenges of the public-private partnerships for healthcare in Louisiana?
Well, I think the advantage is, I mentioned earlier about the payments that we make to the state that allows us to draw down state dollars. That's certainly an advantage. In 2013, right before the public-private partnerships came to be, the state had reduced a lot of services. I can speak particularly for Lafayette. At UHC, we had gone down to only 15 inpatient beds. We closed several of our clinics. It was real scary for the hospital and the patients that sought care at the hospital. And so with the public-private partnerships, with Lafayette General's involvement, we've been able to bring back services. We've opened clinics that had been closed. We're up to 52 beds on our inpatient floors. And so we've really been able to expand our services, and we've been able to become more efficient. Before the partnership, one quality metric that we measure in emergency rooms is left without being seen. And what that means is, I'm a patient, you made me wait too long, I'm going. And I leave, I don't see a physician. So it's a national statistic that hospitals monitor. We were at 16% at UMC before the transition of Lafayette General Management. National average is about 2.5%. Today, we're 0.5% at UHC, so I'm very proud of the work we've done in our ER. And that's just one example of the good work that we've done thus far.
Wow, that sounds interesting. We need those services.
And the challenges is, we're always, the state budget, you have a contract with the state, but they can always come back to you and say, oh, we said we were going to pay this much, but we can't this year. And they cut it, so we're always worried about the cuts that are made.
We understand, but it sounds like the services were quadrupled when they had cut down before. That sounds. What are the advantages, Ms. Linda, or the challenges of the public-private partnerships for healthcare in Louisiana?
Thank you for asking that. Actually, Ms. Fides Castamino wrote this letter back in August 2012. When we started, and I have it here if anybody wants a copy, I say this every time I testify, and we started to, the league said, wait, Governor, don't do this. Study it. What is the cost-benefit analysis? We didn't have any real heartburn with going through a process and understanding it, but the way in which it was done quickly in 1 year. We do not know overall what the cost is. We still don't know. When the bill was passed, they had blank pages that legislatures approved. So that was our biggest heartburn. So we asked the league. Our concern with privatization was that the private position acknowledged that we need to do something because of the situation we had here, but it's the manner in which it was done. And we wanted to have an informed, transparent planning process through analysis and implications of private. Because we said in 3 to 5 years, our health net would be gone. We have contractors watching contractors watching contractors. And now the Louisiana Department of Health started out back then with 12,000 employees. Today it has 5,000. So there's very little monitoring. So advantages, some local communities have seen an increase in services, and that is terrific. Private companies now deliver, monitor, evaluate, and pay for state services. There is no transparency. Once it goes into the private sector, the public does not see it because these are public concerns. Mental health services are now contracted. Primary care shift money went over to managed care organizations. There's 5 insurance companies now that have the managed care operations. Information technology was contracted out with $11 million. So our state brick and mortar systems are gone. It's all privatized. Now, is that good? Some aspects are good, but there's no transparency. Disadvantage, total cost unknown. Institutional knowledge is gone. It's lost from the state. We depend on contractors to tell us what to do now. Initial contract costs, charges, we have no idea what it's costing us, and that's why the cost is going up. When you contract for private people, you don't have the same level of public oversight. And we have 5 managed care organizations right now, this is separate from the hospitals, that are doing insurances. And those each have profit motives in them. We don't know what it is. And that's part of why. I mean, healthcare goes up every year anyway. But we, the public, don't understand it.
Thank you, Ms. Linda. And thank you, Ms. Casamano, for keeping us informed and making sure you hold our legislators to the fire. Mr. Burton, what are the advantages, challenges of the public-private partnerships for healthcare in Louisiana?
I think in the beginning, one of the biggest challenges, and I'm going to talk about it from a state perspective, not necessarily Lafayette, is that if you were one of the 9 hand-picked chosen ones, you receive these public-private partnerships, okay? But if you were not, you received no dollars from the federal government for uncompensated care. And I think what we saw was probably the best example of that was Baton Rouge with Baton Rouge General. When we closed down the charity hospital there, it left everybody that was living in the north part of Baton Rouge without an emergency room under the charity system, which meant they moved to the closest one, which was Baton Rouge General. Well, Baton Rouge General was not getting the uncompensated care from the federal government that the public-private partnership was, and so they eventually had to close down their emergency room. So that's kind of one of the pitfalls. But in 2016, we saw kind of a great improvement, because with the expansion of Medicaid, those folks now had the ability to have their own private insurance, and they were able to have choices about where to go. So what turned out to be something that was challenging for some ended up being an advantage for the consumer. And so they were able to do that. And the beauty is that when a person comes into a hospital, let's say they come to an emergency room, okay? First question they're gonna have after they triage to make sure that it's not a type of emergency is, what is their ability to pay? And if that person does not have insurance that qualifies, they're able to go through, sign up for Medicaid right then and there, receive those services, and the hospitals are able to go back and bill within the last 90 days retroactively. So I think that what we've seen is where some of the challenges that started have kind of worked themselves out.
Great. Okay, anyone can answer this on the panel, but what is the status of healthcare legislation pending in Louisiana? I know, Ms. Linda, you have the handout. You wanted to share some information with us.
Do you have your hand up?
Does everybody have one for the handout?
The League of Women Voters, we follow many, many bills, but the Healthcare Committee chose 5 bills to follow. And you have that in front of you, I believe. And the status of those bills I have outlined. what is really important, that healthcare goes through very different, not only the healthcare committees in a House and a Senate, but it goes through insurance committee. It goes through education. So it's not only one place you can focus. There were over 1,400 bills so far put out this session. We chose 5, and you can see the status and the rationale in terms of what we supported, what we opposed. We did not, finally on HB 6, that was Representative Howell's bill, we were able in the Senate just last week to defeat it. It did leave the House, we testified in the House, it got out of the House, and it went to the Senate, but we were able to, 3-2 in the Senate, so it was very close. Hewitt's bill, we were able to get her to defer that Hewitt is out of Slidell. She is a senator and she wants to put work requirements on for Medicaid. If you were going to receive Medicaid, she wants you to work for it, okay? She wants 20 hours a week and she wanted either volunteer work. So, of course, that's not health care, that's work requirements. Well, we were there, the industry was there, and we were there, and we were able to, at the hearing of 4 hours, we were able to get her to defer the bill. She's now going to put it to a House. I won't go through each one of these, but you can see one of the bills that I was really disturbed about, talking about the public-private partnerships, was HB 152, and it was Representative Baca. And what he was trying to do was trying to get long-term care under a managed care operation, which would have allowed patients to stay in their homes. And we testified, they testified, the nursing home owner got up and testified, and it killed the bill. And unfortunately, those people wind up in nursing homes when they don't need to be in nursing homes. And it would have saved the state, I think he said like $3 million or something, but that's the way it goes. Anyway, look at this. I know I'm getting out of time. Okay, I'm talking fast. At the top, I have put the website in there. If you ever want to follow a bill, it's very easy. Just follow that bill. And if you're not able to go to the session, there is a broadcast. You can go in and you can, it's videotaped. Everything's videotaped, and you can look at it live. And I've got that up there for you.
Thank you, Brian.
Just, I'm going to add one thing too, and that's from the state perspective. From the federal perspective, you know, we've had the Affordable Health Care Act in place now for 3.5 years, and so, but we are under a new administration now, and so under this new administration, there is a new bill which last month has passed the full House, and so it now goes on to the Senate, and we're waiting to see about that. And I mean, unless you've been to Mars in the last month, I'm sure you're all aware of that, you know, what's going on. But I think the most important thing to know about that is under the Affordable Health Care Act, and there are a lot of things that could be fixed, and I'm sure you're going to have some questions, and we'll talk about that. But the main thing is that it moves the center from the patient, where everything that happened and all of the rules and legislation around the, it's called the Patient Protection Affordable Health Care Act, so PPACA. Okay, now it's moved to the American Health Care Act called AHOC, which sounds like somebody's about to spit, but anyway, you know, that moves the power away from the consumer and it gives it to the insurance company. So that's where we're looking for that. Those changes.
Ms. Hebert?
I just had three bills that you may have it on your sheet. I don't know the numbers of them, but one is the medical device sales tax exemption. Another one is hospital stabilization assessment, and another one is the Medicaid provider appeals for a better process. If you want to appeal, if Medicaid denied a payment and you want to appeal it, a better process that's standardized. So those are three things that Louisiana Hospital Association supports as well.
Thank you so much. Thank you, Ms. Linda, for this information. And I know a lot of you don't understand how nursing home works, but most of the beds at the nursing home are Medicaid funded. So each patient in that nursing home has a daily rate that they're paying, that the state is paying every day for each person in that nursing home. So that's where the costs come in for Medicaid with people who are in the nursing home. And if you think of the nursing homes and think of each bed, there are some that swing in and out, hospital, and some go back to long-term care. So it depends on what your needs are, if you need skilled nursing or not. So when you think of a nursing home, think of each bed in the nursing home. If the federal government decides to give states options to waive certain insurance market regulations, how do you anticipate Louisiana will respond? Ms. Avery?
That's a tough question. I really don't. I would look to my other two panelists to maybe help out with that one. I think there's so many unknowns in Washington right now regarding repeal and reform, and Brian spoke to it briefly. From a hospital perspective, we're just watching very carefully to see what takes place, but we're really not speculating at this point.
Thank you. Anyone have something to add? Just hold it.
I do, of course. Well, all you have to do is look at our legislatures today. It doesn't take you very far. They continue to weaken the protection of the citizens. They continue to deny and set up barriers to access to care. They cut the funding for health care programs. They don't support vulnerable patients. Past 4 to 5 years, many of the bills and the policies demonstrate what will happen in the future. So it's not real complicated. So whatever comes down from above, today and for the last 4 years, they've been trying to limit access to health care, put in waivers, put in mandates, put in work requirements, make people pay co-payments, make them pay premiums, make them do whatever to deny access to health care. So they're doing that today. So what do you think it's going to be when or if it changes?
But one thing I can say is that they keep trying.
They do.
They keep trying, and none of this is passed. And so this comes from you guys. This is your ability to stand up and be heard. I think more people are engrossed in their health care and what is going on now than they ever have before. So we just want to encourage that. I tell people all the time, if you're happy with your health care, contact your congressman. If you're unhappy with your health care, contact your congressman. We're just here to explain the law to you, and if the law changed, we'll be here to explain the change as well.
Thank you, Mr. Burke. Our next question is, what are the biggest challenges moving forward that you see to provide health care for all people in Louisiana? What do you see the biggest challenges?
I think the biggest challenge, is several things. I think that one is misinformation. I think that there is so much misinformation about healthcare industry and how it works. In the very beginning, you heard Ms. Hebert talk about the Affordable Health Care Act and the things that they had to do as far as making quality over quantity with patients. They talked about medical electronic records. You don't realize that this law is so encompassing of everything. That's why it's so big. It was not just connecting you to insurance companies or covering your health insurance. There was so much more to it. So I think the biggest challenge for us is the misinformation that goes around the law and what it's about and what's happening with it.
Thank you, Mr. Burke.
Well, I'm going to be a little bit more direct. I think the ideology and the practice by some of our legislatures and the outside influences that are coming to each of us through national, what would I want to say, guidelines or laws that are being passed around nationally that are being now implemented in every one of these states. I think that is going to be, it remains one of the biggest challenges. They're telling them how to stage it, the tactics, what to use, and go up and promote it forward. I think the medical industrial complex in terms of how they view the patient. You know, is the patient now a product? Is it a commodity? What are we now?
You know, for me, I think, you know, when we talk about the challenges, especially in Louisiana, I don't deny that healthcare costs are expensive and continue to rise. Even with the matching federal dollars, it still makes up a large portion of our state general fund. Part of that is that we are taking care of more patients. In the past, before we had the public-private partnerships, it's hard to compare the dollars that were spent before to the dollars that are spent now, because you're not really comparing apples to apples. There were a lot of people that weren't receiving care that are receiving care today. There's a cost attached to that. But as a healthcare provider, if I look at healthcare in the state, I think really our biggest challenge is to get all of our citizens identified with a primary care provider. When we expanded Medicaid, all of a sudden there were lots of people that had a Medicaid card. With it should have come a primary care provider. That has not been always the case. And so, unfortunately, some of those patients end up in the emergency room. That's the highest cost area to receive health care. And so what we need to do, what we're working on with Lafayette General and UHC, is to provide an urgent care setting for Medicaid patients. So that on a Sunday afternoon when you have an earache, today your only option, if you want to see a physician, is to go to the emergency room. Again, the place where it's the highest cost to deliver that care. If we have an urgent clinic that a Medicaid recipient can go to, then they're taking care of it at a much lower cost, more appropriate for the care that they need. So I think if we can focus around the biggest challenges is focusing around primary care for our patients, and also to focus on a healthy lifestyle, keeping our citizens healthy, and also providing wellness health, where we're doing those annual screenings where we can catch things, disease in the early stages, and hopefully cure you.
Well, we all understand about having care before we need to have emergent care. So I think that's an important role and an important one of the aspects of healthcare and why it's so expensive is a lot of people don't have a home.
That's correct.
A treatment home, that's right. What resources do you think are available for the general public to help us better understand this changing healthcare delivery and financing for our state? What resources are available just to help the regular person that doesn't know a lot like y'all do about healthcare? How can I find out information, or anybody else find out information and be able to follow what's going on?
Well, it's easy for me. I'm going to say navigators. You know, we have one here today. I mean, look, just to kind of piggyback off of what you said, you know, for many people, this is the very first time ever that they've had access to health care. They're used to a charity system that goes back to Huey P. Long in the early 30s, okay? And so it's information that's been passed down from generation to generation, and it's going to take some time. But I think that one of our biggest challenges is going to be that health literacy. And so I know in 2013 when we first started this and we went through the first open enrollment and we enrolled all of these folks, and we made sure that they had an insurance card, you know, Blue Cross Blue Shield, Advantage. We realized that they had no idea what to do with it. And so for us, we started to put together a program that we've got here in Acadiana, as well as all throughout the state, called From Coverage to Care. Because now you've got coverage. Now that you've got coverage, we need to get you into care. And so that's health literacy training. What that is teaching folks, one is, well, the whole concept of a primary care physician, because remember, these are under Medicaid, it's managed care, which means a primary care doctor sits at the center and directs all of your care. You know, for them, they're used to using an emergency room, which you just go to the doctor, you get it fixed, you come back, you know, and so we've got to teach them that. We've got to teach them preventative. You know, under these insurance, there are several things that don't even affect out-of-pocket expenses or anything like that. Most of them are free, and that's your preventative care. So it's how to be screened prior to getting sick. And so these are a lot of the resources. This is what we could provide. We've got navigators throughout the entire state. We've got 2 right here in Lafayette that cover the 7 parishes of Acadiana. Those charges are free. We work with hospitals. We work with all different kind of groups to educate those folks.
Well, join the League of Women Voters. Come sit on our healthcare committee. We have brochures back there. Pick up some of the handouts, coverage to care, pick up the book lists. They're all back there for you. But I'm going to give you some others to look at, okay? I follow Louisiana Budget Project, and I can provide you all with the websites, and maybe you could post it. I follow Kaiser Family Foundation. They just came out today. Talking about physicians in primary care in Louisiana is one of the worst, of course. Ratings in terms of turning out physicians. Economic Policy Institute is another one I follow, and it tells me, you know, rates like what Louisiana is going to lose and how many jobs we're going to lose. 35% of our jobs in Louisiana are hooked to healthcare. SALUS, the Hospital Association, 100,000 directly employed and 300,000 indirectly employed. That's by the Hospital Association in January. So any changes, the economy, especially your economy here. You all lost 6,000 jobs in January in Acadian area. It was in the paper, I have it here. And so that's from the oil industry. So what are you going to do? How are you going to replace that? So this is very, very critical times that you as citizens must get involved. So the other one is the Commonwealth Fund, and they're very good. They come out, and if you're on our committee, I send these out all the time.
Thank you, Ms. Linda.
I don't really have anything to add. I think y'all covered a lot of resources.
Okay, thank you. What are your biggest concerns about the forecast for healthcare in Acadiana and Louisiana? Ms. Avery?
Well, you know, I'm talking about the state general fund again, and I guess my biggest concern is that there will come that, you know, if there would come a time when the public-private partnerships would not be funded, and we would be in a situation where we would have to walk away. That would be devastating to Acadiana, to the state. We see over 8,000 patients in our clinics every day. We see almost a little over 4,000 patients a month in our ER. The other hospitals that we have in Acadiana would simply not have they wouldn't be able to take on that extra volume if we closed our doors. I'm not expecting that to happen, but that's worst case scenario. The other thing, you know, when you talk about the shortage of healthcare providers, there is a shortage of physicians and nurses in the nation, and they're expecting that to even grow higher as our baby boomers begin to age and need healthcare providers. And we have graduate medical education at UHC, so we're training about 80 residents within the walls of our hospital, and we know through national statistics that residents usually stay where they train. So if we're training doctors in Acadiana, the likelihood of them staying is much greater. If we would have to close our programs, it could be devastating to Acadiana because we would realize a shortage of physicians as well. We also train nurses there, as well as other healthcare specialties. So that's what I worry about.
Thank you, Ms. Avery. Ms. Linda, what are your biggest concerns about the forecast of healthcare in Acadiana and Louisiana?
Well, I'm going to address Ms. Katie, what she just spoke to, with the private-private partnerships, and you can correct me on this. I understand the contracts that you have 2 months and you can bail out of these contracts.
9 days.
3 months. So if in fact they decide, and they can decide to do that, they're private at any point in time. We do not in Louisiana have a backup system. We got rid of it in 1 year. We got rid of everything we could as quickly as we could. So that's a real concern, okay? So we got to make this work. I'm not sure we're going to do that now. But the human cost, that's what I worry about. I worry about the safety and security of our citizens. I worry about the economy, the further erosion of our foundations, the lack of appreciation, understanding of the citizens who are paying the taxes to receive the services. That's what we pay taxes for, to receive services that we can't afford. I worry about those things. I worry about the other things that are going to consequently come. If we have a hurricane in Louisiana again, we are not prepared. We are not. We don't have the systems to support it. There was a study that just came out on that. So, you know, we are teetering here. So, the other thing is, and I'm probably running out of time. Okay. On your list, you all have the power to do something really great. On this list, you have 2 of the most powerful people in our legislature. You have Eric LaFleur, Senator of the Finance Chair. They are now discussing how are they going to pay for it. You need to contact him because they're saying no one's contacting us. You all need to contact him. You have Taylor Barris, the Speaker of the House. And he listens to, guess who? Who does he listen to? He listens to his House people. He put people on the Ways and Means Committee. That's how they control it. You must get engaged, citizens. You have a lot of power here. And you need to call them. You need to call them tomorrow. I have their numbers right here. And you need to tell them they need to fix this.
Thank you,
So,
Mr. Burke.
my forecast, I've looked into my crystal ball, and it's awfully cloudy. You know, I'm worried. I am worried that the system we have in place, though it needs to be fixes, the things that that our leadership is trying to fix is not fixing them. I worry about the subsidies that help people pay for their health insurance. It's based on a health equity model, meaning that it brings everybody to the same purchasing power so that you could go into the insurance market and purchase your insurance. You know, if you're 200% of the federal poverty, if you're 200% of the federal poverty level, you get a much more bigger monthly subsidy to help pay for it than if you're at 300% of the poverty level. It's a system of health equity. It brings everybody to the same spot so that you can go in and you compete with these insurance companies. I worry that under Medicaid, where it is an open system, so that consumers can go in, the state, the federal government covers 90% of the cost, the state covers 10%. I'm worried that this will become a per capita, so that each person receives a cap, and so once they meet that in a lifetime, they're capped out, they get no more. Or that it is a block grant where the state gets X amount of dollars and they have to divvy that up between all of the people, and so, how is that going to work? So those are some of the things that I worry about. I worry about the 10 essential benefits. Right now, when we look at health insurance, we can look at any different plan that's in the marketplace and know that they all cover the same thing because it's the law. If you start to mess with the 10 essential benefits, and you let states allow for different ones, as you go to compare apples, you're comparing apples and oranges because these plans will no longer look alike because you'll have to read all of the fine print. And believe me, an insurance company can make an awfully fine print. So these are some of the things that I worry about.
Very justified concerns. What are you optimistic about?
Pick that one up. Since I ended up on a cynical, I'm going to come up on a positive. You know what? For Louisiana, we don't have the exact numbers, but we're probably just a little shy of a 10% uninsured rate. Okay, and that's for the first time ever. And if you look at nationally, you will see that our uninsured rate nationally is about the same. This is I printed this. This is hot off the press, so it's latest information as of May 15th. I do see a typo in each one of the little squares. Well, I broke it down by the 7 parishes so that you could see how many people received marketplace and went to the federal marketplace and purchased insurance. How many people received what the average tax credit was. That's a tax credit they could apply to the insurance each month. How many people were enrolled in each parish in Medicaid? And the last part is the number of people who received preventative care, you know. So yes, there's some challenges within Medicaid. There's not enough specialists in there. The reimbursement rates need to go higher so that more doctors will accept it. But at least consumers have access to a primary care physician. And so they're not having to wait for that. So I'm optimistic that we've moved forward, that we've got 435,000 people in the state of Louisiana, 55,690 enrolled in Medicare just in our 7 parishes here. So those are the things that we're optimistic, and I'm optimistic that the consumers around Acadiana are engaged in their health care and they're fighting to keep what they have.
Thank you, Mr. Burke. Ms. Hawkins?
I am optimistic too, because I think more citizens are getting engaged, trying to understand this complex system. And I think that the more they become engaged and contact the legislatures, that's what you need to do. I know it's kind of a broken record, but even if you call them every day, call them once a week, send them emails, let them know you're there, say, hi, here I am. But the system now is a profit-driven model, okay? Cost is difficult to contain. We can't contain healthcare costs. One of the things and we haven't been able to contain it. One of the models, there are various models within the healthcare system, and one of the models, of course, is your Medicare model. Some of us have that. That's called single payer. There's also the socialist model. That's the VA hospitals and the Department of Insurance. That's the socialist model we have here. We have private insurance driven. We all know what that is. That's Blue Cross Blue Shield, United HealthCare, da-da-da-da-da. We also have something that's kind of new that's coming into the state. It's called direct primary care physicians. It's in about 40 states, and they will not take insurance. They will coordinate your care. It's concierge care, and they'll take care of you. But I ran into one when my mother was in the hospital. That's how I know about this. And he started over in Metairie. And we have co-ops, and those co-ops are owned by religious groups. So a religious group will go in, and they'll have all their parishioners who believe the same, and they'll put money in, and they'll cover themselves. We also have self-insured. If you're wealthy enough, like many of the people are, they insure themselves. Or if you're Walmart is self-insured. It insures all its own people. We have medical tourism. And medical tourism has been around since 2000. Actually, Blue Cross Blue Shield participates in it. They send their patients from California to Mexico, okay? They send North Carolina patients to Thailand to get theirs because insurance and health care is too expensive in Louisiana, okay? Or the United States. And so what the league does, I want you to pick up one of my Fix-Its back there. We have a solution. And it's been around for a long time. It's called Fix It, and there's a brochure on it, and it is single payer. And I go around and show the video to small businesses because it's basically for small business operations. So we have all these different models, and we could introduce a single payer into the model. Okay.
Thank you, Ms. Hawkins.
So I'm very optimistic. I'm optimistic that we're talking about health care and that people are really wanting to know what's happening and want to learn more about it, because, you know, healthcare is very complicated, especially when you talk about how we are reimbursed and everything. So the more you know, the more powerful you can be. You know, from a local perspective, from the work that we're doing at UHC, I'm very optimistic. I believe that we do good work. As I mentioned earlier, I think part of the work that we're doing in expanding our services is a good thing. And as we look into the future, we are developing a lot of strategies that we hope to address many of the things that we've talked about tonight. The primary care provider, making sure that everybody has a primary care provider. We've talked about having navigators within our own hospital system to have conversation with our patients on the phone, making sure that they took their diabetic medication, they took their insulin, checking on their blood sugars, their blood pressure, just by making a phone call. We also, another thing that I'm optimistic about is the technology that we have today. We're just beginning to embark upon telemedicine. We're going to be able to provide telemedicine at a lower cost for our patients, instead of them having to come into the hospitals, where we would be able to have a physician see that patient remotely. Things like that will be able to reduce healthcare in some circumstances. So I think there's a lot to be positive about. We all still have our challenges that we've discussed here tonight, but I think there's reason for us to be optimistic as well.
Thank you, panel. That's all for our questions. I think you brought up a good point, Ms. Hebert, where social services will now be involved in people's health care. I think that would be important, don't you think? Don't you agree? Because there are a lot of barriers just with social services. Before you even get to someone's health, you have to understand what makes up their whole health care, what makes them a person and how they're going to access care. That ends our questions, but we're going to open the floor now to a few questions from everyone here. Yes, ma'am.
With the Affordable Health Care Act, you hear a lot of complaints about the premiums. The premiums are going up, my rates increased. Can you give me your opinion on why that has happened or what we can do about that?
Premiums have gone up since day one. What I think is important to note is that since 2013, the premiums have slowed down their increase, not done at the same pace since the Affordable Health Care Act. But there's different challenges. I think that if we're talking about people who are receiving advanced premium tax credits, those subsidies to help pay for that, what's interesting is that when those premiums go up, those subsidies go up as well. But then our big challenge with this is that, and this is one of the things that I think should have been fixed, subsidies go up to about 400% of the federal poverty level, okay? After that, you're deemed to be able to pay for them yourself. And what we hear all the time is people who are at 450, 500, 600, it's still not affordable to them. So one of the fixes probably should have been to expand those parameters for which subsidies are available to help more people pay for it. Yes, healthcare is expensive. It is. Health insurance is expensive, I think that if we had, and Lafayette's lucky, you've got 3 different insurance providers fighting for your dollars here. So, as long as you've got the competition, that helps to slow the price of that. Some communities, not in Louisiana, but in other states, are not so lucky.
I'll answer it from a different perspective. Well, insurance is by every state. In 1944, the McCarran Act established that each insurance would be controlled by the states. So it's not the same in Texas, it's not the same in Alabama, it's not the same in California. So when we talk about insurances and we talk about premiums, our Department of Insurance, Donilon, indicates that he has no control over premiums because the legislature has not given him the authority to do it. And that is true. California, there's a commission that sets it. Now, the other part of it that we don't know about is that we don't know what the reserves are in these insurance companies. They're sitting on, when they come out with their little commercial, and they say, oh, well, 2%, 1% goes to care. Well, how much did they pull out and put in their reserves before they showed us what their operating expenses were? You don't know what's being done. And each state does it differently. And each, the law allows this now. It's just like the NFL, you know? It's by the same thing.
One more thing I'd like to add, one more thing, is that also health insurance rates are based on health outcomes in the community. Again, you know, I said one of the first things they do is they ask you what your zip code is. And so that zip code is to determine several different things. One is to connect you with an insurance provider in your area, but it's also to look at the health outcomes for your community. And so one of the greatest ways to get health insurance rates down here in Acadiana is to improve our health outcomes. And so, you know, I think that we're going to see that. When I look at the number of people, the 11,000 people who've had preventative care so far this year in Acadiana, you know, this is what's going to eventually help to slow those rates down as well.
But we gotta leave the rice alone.
Who that?
Yes.
As you speak to the state of mental health care in Louisiana.
Could you repeat?
The state of mental health care in Louisiana, I don't know, I'm gonna let you answer that, but I will tell you from a hospital perspective, Louisiana is like everyone else in the nation. We have a crisis in mental health care. Our emergency departments, we see a large percentage of mental health patients every day, and it breaks my heart because it's really that we don't have enough place for treatment for our patients in mental health in Louisiana, and I think part of it is the way we're reimbursed. I'm not an expert on mental health at all. I just see it in our hospitals, in our emergency departments.
Well, we used to have facilities to care for mental health. We used to have it in Mandeville. We used to have them all over. Now we have one, I think in Pineville. So our former governor privatized it. He put it out to managed care organizations that are supposed to be handling it, but we have no facilities. So those facilities, like the jails, the emergency rooms, there's no place to take folks. There's no place to take folks. And everyone can't be treated at home when they're in a crisis. That's as simple as it is. And when you have people that are going to Pineville, is that where it is? They're not by their families. They're not by their support systems. So we don't have the systems anymore. So they go to the hospitals, they go to the jails, they go to wherever they are. New Orleans is now going to be looking at building a whole jail unit for mental health. That's kind of weird. That was in the paper today. So it is. When you take the facilities and the services away, guess what?
We've got a long way to go. We've got a long way to go. But I'll tell you, if you asked me the same question a year ago now, I would have a lot less optimistic look. What I can see, and if you go to healthy.la.gov, that is the website for our state's health department's Medicaid program. And on there is a button that says Medicaid Dashboard, and you can click that. And that's where I get these numbers from. And one of the things that they've started to add is the Medicaid numbers for each parish. I'm sorry, for mental health Medicaid numbers, so that you can see how many people are getting services. There's not enough providers, there's not enough yet, but at least we're starting, and we're much better today than we were a year ago. And so I just hope that we don't go back, that we continue to move forward.
I will tell you, I'm glad you mentioned that, Brian, because it made me think about it. Since Medicaid expansion, we have been able to place patients that come into our ER. We have been able to place them much easier because they have Medicaid than before when they had nothing. And so it used to be, you know, sometimes we'd have patients in our ED for a few days before we could find a proper place for them. But now we are able to get resources for them.
Questions? Yes, ma'am.
This is really for Mrs. Hebert. What do you think is going to be the worst, your most biggest concern if the AHCA would pass as a hospital?
You know, it's hard to really speculate because there's. I don't really feel I know enough about what. I don't think anybody does. I mean, I don't think there's a lot of unknowns right now. I think that it's gonna. We're all I can tell you is we're watching it very close. Even when you look to the American Hospital Association, Louisiana Hospital Association, nobody's really forming an opinion yet. Waiting just to see what comes out of that.
And do you know why that is? It's because if you notice in the law, what the law does is they like to say that this provides more flexibility to the states, okay? What this really means, and translated into everyday language, we don't need more flexibility. That's what Dr. Gee, our health director, says. We are flexible. It just means we're going to put it up to the state, and the state can do whatever they want to do with it now, okay? And so we know we can't pay for the services that we have now. That's why we've got $235 million that need to be cut by a health secretary coming out of this legislature. To put all of these federal dollars, remember, they're not changing our taxes, okay? We're still paying this money into the federal government. It's just going to go different places now. That's how we got expansion into Louisiana. Was part of the argument was we want our dollars coming back into Louisiana. So it really does leave all of this up to the states. And because Louisiana is not a wealthy state, we're pretty much the opposite, there's a lot of fear in what the state would be able to do if all this was on their responsibilities on their back.
We are 49th in the country in terms of healthcare outcomes. We were 50, but now we went to 49th because we got Medicaid expansion. So it has done a lot of good things. Yes, it is scary, and basically what, I'm following up on what Brian said, what it is our dollars are going to be the same. We send $1.78 approximately. I mean, we send every dollar we send to Washington, we get $1.78 back. That's how poor we are. So what they're going to do is basically not send those dollars back. They're going to keep them. So that's why it was important that we got Medicaid expansion. Remember when we got Medicaid expansion this year, it's funded at 100%. Now if we had done it 3 years ago, we would have been funded at 100%. So we really don't know. But on your sheet at the bottom, I've got Kennedy and I've got Cassidy listed. You need to call them. You need to let them know what your feelings are in terms of the legislation that is at that level. So it's up to you. The ball's in your court.
Yes, ma'am.
I have a couple of things. So first, I'm an RN, and so I've worked here in Lafayette, and I've worked private, and I'm from New Orleans. I worked big charity there. I've seen that whole system. I'm one of the aging baby boomers who's about to get out of healthcare and consume healthcare. Right? So that's part of our crisis. And I think in this room, if I look around, I recognize some faces, and I know that a lot of people in this room are making these phone calls. So this is, like preaching to the choir for us. I work right now with the Office of Public Health, and I am charged with providing care for a certain group of people, and that is young women having their first babies. I look at this as a real opportunity this is a new family forming, this is where we empower people. many people, their first health care is when they are pregnant, their first experience in a hospital. This is how we do it. They, 2 years ago, 60 days post-delivery, they were kicked off of Medicaid. Now they've got Medicaid expansion. I am frustrated with trying to help them. How do I help them to empower, for them to make phone calls, right? Because they're about to lose something that I'm not going to lose. I have private health insurance right now. And they've been so long without, it's kind of like, oh, well, if they take it away. And I'm frustrated because even when I, a fairly articulate person, call my legislators, both state and federal, it's also partisan. It's like, wait a minute, we're all people here. Please stop that. And so, and I know we have health fairs and we do this, but you were talking about navigators and being in hospitals, and so, and I put them in touch with Healthy Louisiana and everything else. But still, the general public that is making use of Medicaid expansion are not empowered. And I was wondering if you had any hints for better ways that we can reach out.
I'll tell you, I can sit there and I can talk to our lawmakers and I can say, this is what will happen to this group of people. This is what will happen to this group of people. But nothing makes an impact saying that this is what will happen to me. And so I know that that is extremely important. Getting people to be involved in the process is a challenge, you know. And so I thank you for the work that you're doing with young women. It's a greater time now for them to be having babies than ever before because they can stay on the insurance, you know. And so, and it's having a baby is no longer a pre-existing condition, but it's for right now. And we do that, and that's great. Take Charge has been a great program for Louisiana, but men, you know, for one thing, men had very little, they hadn't access, unless you had a severe disability. You know, prior to Medicaid expansion, men had access to nothing unless they wanted a vasectomy. That was the only thing that a man could get under Medicaid. And so it's a new age, and I'm serious. I mean, just to keep you from having more babies. It's tough. I don't know the answer to the question on how to motivate people to get out and contact them.
I gave them postcards, you know, because, you know, picking up a phone and talking to someone who's a person of power, when it's kind of, how do we reverse that where you're the consumer, you have the power, he works for you, you know.
Well, it is hard, but I think it just comes with one-on-one. And if you can make through, maybe at your churches, maybe at, you know, gatherings, at the youth groups. It's just going to happen in those small events. Now, if you go to the league site, I have my card back there, there are some videos on there, and there's some young people speaking to why healthcare is important. And, you know, those kinds of resources are available. But I would tell you to do that. I would tell you to go to the youth programs. It's hard to get into some of these places because of the issue you spoke to in terms of the partisanship. I know I can't get into many places. I have gone into some Rotary clubs lately. But chambers of commerce, places like that, it's closed groups. And it's unfortunate because we need to get the message out. But I think just going in and to the, I don't know, basketball groups or, you know, the churches but it is hard.
I agree with you. I think everything you said was on point. I think if you can get in a group setting or you can get to someone in a leadership role that can really make an impact. But I think the bottom line is many of these people don't feel like they can make a difference. They don't feel like, oh, it's just me sending a card. They don't care about that. And it's really bringing home the point that we all have power to impact change if we do it in a group, you know. But there's not an easy answer for that.
More questions? Yes, sir.
Well, it was mentioned by Ms. Hawkins about Louisiana is like number 50 or moved to number
49.
Correct. questions. One would be, are there any segments of those lists where Louisiana is improving? And secondly, you guys are in touch with legislators. Are they ever embarrassed by the fact that Louisiana is, way down on the list, that it remains at the bottom of the list? Just in time for you.
Yes, just in time. They know it. We tell them. We write Senator, what's his name, Cassidy and Kennedy. The league just wrote a letter to them in January telling them where we worked, giving them the numbers, telling them they are not to repeal it without a significant replacement, at least better than. We tell them. We go where we testify. I've testified for health and welfare. We say the numbers, we tell them, they look at us, and they vote us down.
Well, let me introduce Representative Dustin Miller, who is a native of Lawtell, Louisiana, and represents House District 40, which includes a significant portion of St. Landry Parish. As a matter of fact, one of our parish and has a lot of problems with literacy there. Among the committees and delegations he serves is the Health and Welfare Committee. We are especially grateful that Representative Miller was able to run away from his duties, just drove in from Baton Rouge to join us here. We only have about 5 or 10 minutes left, but we're glad that you're here, Mr. Miller. Thank you so much for coming. Would you like to enlighten us with any information or anything that happened today?
Hey, good evening, everyone. Like she said, I did run here from the legislative session. I just passed 3 bills on the floor today, so I had a busy day. One bill was amending the tax credits given to physicians in rural areas, medical providers in rural areas and underserved areas. That's very critical right now in the state of Louisiana. My other bill was related to mental health. I think it was a major accomplishment today. What we did was, right now, if someone is being involuntarily committed, if you're in the courtroom, DHH is not there. The judge makes a decision. Pretty much the law states that he may commit you to the custody of DHH. But yet now we have so many other services. We have group homes, we have therapeutic homes, we have drug rehab homes. So what my bill did was make it a law that the judges must notify DHH if there's a involuntary commitment trial coming up. So what DHH is going to do, not going to make the decision, the judge still makes the decision. DHH is just going to let the judge know all of your options. So someone may be having mental issues due to drug reasons. There's no reason for you to be institutionalized in the state of Louisiana when there's therapeutic group homes, as y'all can see, building all over the state, and they're real nice. So still going to be up to the judge, where do you go? But at least we're going to have someone there from the state of Louisiana letting the judge know all of his options. And I think that is going to really, really help the citizens of Louisiana. And I mean, it's always best in my eyes to receive care close to home. You may have kids, you may have siblings that would like to come and see you. I think that's a critical step in the part of rehabilitation. I think I walked in the middle of a question related to, do the legislators understand the importance of healthcare?
Are they ever embarrassed by the fact that Louisiana is the bottom of the list?
You know, to be perfectly honest with you, I believe the Senate understands that. I don't believe the House of Representatives understand that. And look, let's be serious about it and ask ourselves why. The system has been abused for so long. We're having a tough time making certain parties understand that healthcare should be a right. We should offer people healthcare. There's no reason for someone, a family, to be working, earning minimum wage, $7.25 an hour, and working 40 hours a week and cannot afford health care in the state of Louisiana. That's why the governor did the Medicaid expansion. There's no reason. I mean, you're working. What more can you do? Not everyone's going to go to college. And some people love their job. I mean, if you take a look, I'll say example for a janitor. He loves his job, and he's working 40 hours a week to feed his family. If he's renting a home, by the time he pays his rent, by the time he gets groceries, God forbid, pay his kids certain things in school supplies that they need, they have no more money at the end after that. So I think that Medicaid expansion was great, especially for that population. But what I'm realizing in the House of Representatives, a lot of people think there's just waste. We're wasting money if we give people Medicaid. Medicaid people go to the doctors and they have Jordans and they have iPhones. That's what they think. They don't understand that with this expansion, how many cancers, breast cancer in women was found, how many colon cancer was found in men, how many polyps was found because of cancer screenings that now providers are able to order because you're insured. They don't understand that, and it's hard for us to make them understand. And I can't sympathize with them, but I must say that the ones that are beating the system, I would encourage them to stop, because that's what some of the other party thinks, that everyone is beating the system, and this is not true. Medicaid expansion has saved a lot of lives and have been very impactful here in the state of Louisiana. I don't know if I covered everything there. I just tried to say a lot in 3
You
minutes.
hit it right on the nose. We were talking about mental health before you came in. We were talking about not having anywhere for people to go. And I think you just talked about that. You just addressed that. We appreciate that information. You talked about an area that a lot of people don't like to touch, that it's always the Medicaid recipient that has some kind of ulterior motive for getting Medicaid. And I don't think that's the case. I worked in Medicaid for 24 years as an area manager, so I understand how the public views a lot of people who receive Medicaid. And they don't understand that Medicaid is health care. And what we should be concentrating on is the health of our population, so that we can get out of the bottom half. And we should be concentrating on that. And it doesn't matter what the people wear. That's your business. That's not our business.
And if I may, healthcare is very important. We all know that. But what I don't understand is the business industry. Business industry do not lobby for healthcare. But if you think about it, anything in healthcare, only people who get the money is the businesses. I mean, look at a doctor, it's a business. Look at a hospital, that's a business. The radiologist, when you're going to get extra, that's a business. But they do not support or lobby, for instance, the biggest business lobbying industry in the state of Louisiana. They do not count our votes when it comes to cutting healthcare. So it's like and I don't understand that. They do count our votes when it's cutting businesses, taxes, exemptions, and that stuff. But healthcare, they do not count our votes. So at the end of the year, when you see the scores come out and people like me, my scores are F, just know that they did not count any of my healthcare bills. They only counted bills that affected other businesses. And she mentioned mental health. The state of Louisiana is facing a lot of lawsuits right now due to not having enough beds. And the judges until my bill become law, the judges are required, if you're incompetent, they must commit you to a state facility. So that's what, I'm so happy about my bill, is if it passed, it will, you don't must, it said it may. So the judge can make the decision if you should go into a mental facility or if you can go into a rehab place, hopefully right near your home.
Ms. Jones?
Yeah, Representative Miller, one of the things that I've heard for as long as I can remember is the fact that the only place the budget can be adjusted on the state level is in healthcare and education, which are, to me, the two most important areas that we should be putting money into instead of taking money out of. So every year when the legislature has to deal with the deficit, money's coming out of healthcare, money's coming out of education, and we're suffering as a result of that on so many different levels. Is there any possibility that the legislature might at some point in the future look at changing that so that other areas can be impacted and not just healthcare and education?
That's a touchy subject. And there's several answers to it. It's just not one direct answer. He said Constitutional Commission. That had been a talk that I think is increasing momentum as we speak. But if you follow the legislature, there's a lot of bills that come up to try to undedicate funds. Some of them probably should be undedicated, but a lot of them, when you start trying to undedicate, is dedicated for a reason. Meaning, like, a certain percentage of the game and now goes to the horse racing industry. I'm from St. Landry Parish. We have a casino, Evangeline Downs. Do you think I can ever support a bill to defund the horsing industry? And then they come to the table and they say, if you defund us, if you undedicate those funds, you'll kill our industry. Our industry brings back $1 billion a year. So that makes it complicated. But now healthcare is about 80-something to 90% of our budget. It's a big part. I mean, $16 billion budget. Of course, $10 billion is federal dollars. So that's not talked a lot. But that's why healthcare is always picked on, and also with higher ed. So it's several things we have to do. But if a constitutional convention is ever called, they look at all of that stuff and they will undedicate some of those funds that are now dedicated to certain entities.
So the only way that it could be changed is with a constitutional convention?
That's where we look at everything. That's where everything goes on the table and everything is looked at.
Yes, ma'am.
I think this is going to be some of Mrs. Harper. Some of us are going to visit Bill Cassidy when he goes to Liberia on Wednesday. Hopefully we'll get to see him. Can you suggest some talking points on healthcare?
I do have some talking points. I actually I'm also a commissioner in the Department of Insurance for Louisiana HealthCare Commission. I represent the League of Women Voters, by the way. We have a seat there, and we have for years. And actually, I was in a panel discussion with one of his staffers in Blue Cross Blue Shield. And yes, I can give you some questions for him. Essentially, although his and Senator Collins' plan is being promoted as moderate, it is not moderate. And it's block grants, it's health savings accounts, it's giving more flexibility to the states. So basically what it's doing is kicking the can down the road to the states, and we know what our state's going to do. I mean, we have proof for the last 4 years what they're going to do with it. So yes, I can give you some pointed questions and talking points, but they're the same talking points we talked about up here, essentially.
Okay, well, I'm sorry. Go ahead, Kathleen.
So I have a question for Representative Miller. So when you're in committee and you're discussing legislation, healthcare legislation, who are the lobbying groups that are fighting good legislation? I mean, you mentioned lobby. I mean, are there groups that we can sort of put pressure on to, like, outside?
Well, the issue that I find when it comes to healthcare, it's not who's fighting against you, it's who's fighting with you. So let's say the Medicaid population, there isn't a paid lobbyist besides for possible to buy you health plans who do minimum, who's gonna be fighting for you, but they don't have any big player lobbyists on their staff to come here and fight. But you have big industries, they pay big dollars for lobbies. So when it comes to healthcare, very seldomly do you see lobbyists really fighting to keep Medicaid services. But they're there for you public-private partnership hospitals and stuff like that, which was protected in this year's budget. When you go look at the budget, we are cutting them, but only a certain percentage because their lobbyists only allowed us to cut them a certain point. So they're protected. We're cutting the small local hospitals who don't have the big lobbies, but we're protecting the public-private partners, which I totally disagree. Because you're going to end up closing all the local hospitals, and the only ones you have left is the public-private partners who, when Jindal got rid of what was called the charity system, said it was going to save us so much money. You go look at the budget, it's triple. It's triple, but to their defense, they're offering great service. They've expanded because now,
I was about to say that.
because now we can't control their budget. When there was a state hospital, if the state had a budget crisis, God forbid, I'm glad they're not open now as a charity because we would have probably closed them all down. But we would have been able to say, okay, we're cutting you $3 million. So what they would have did was we close their orthopedic unit down or their cancer, their oncology unit. Where now it's ran by private companies. We can't slow their budget down. They are seeing as many people, which is good for the citizens, and their budget is running up, and then they send us a receipt and we have to pay for it.
But that bill, that HB 152 that went down with the Barra bill for nursing homes. I mean, we got up there and we all testified and everybody was in agreement, and then one nursing home unit gets up there and it goes down. Right?
The nursing home.
You were
has a
there?
large lobby.
That
They have a lobby.
that goes to,
Nursing home.
Yeah, nursing
that
homes
goes
have
to
a
the
large
lobby.
More
lobby.
powerful than oil and gas, more powerful than business and industry.
They've been there.
I have to agree with him,
They
they're
carry
very
a lot of
powerful.
clout.
And check out the owners, they're all
That's right.
previous
They're lots.
legislators too.
Or current, huh?
They are.
Does Hinskin still own the nursing home or not?
As far as I know, he doesn't own, he manages one. I think he's maybe the director, but I'm not sure.
He was an owner.
Yeah, I've never looked. If he was, he probably still is. I've never looked.
His family owned it, yeah.
Okay, well, it's time for us to wrap. We have had a very rigorous discussion. I'm sorry.
I just have one question for Representative Miller. On Wednesday, House Bill 533 will be coming to your committee, and it truly impacts public health. It's a water standard, drinking water standards bill that originated in with Marcus Hunter. It's going to help more so the rural communities, and what we're looking for, or what the bill will serve to do, is to work more with the health and hospitals with regard to catching the drinking water deficiencies a lot earlier.
Is that authored by Marcus Hunter?
Yes.
Sure, that bill, that wasn't one that was heard last week? He had 2 drinking water bills last week.
Something's coming up to,
So he has
Well,
another
it
one.
was-
Okay, wow, he's
yeah,
a drinking
it-
water man this year. That makes 3. I mean, if he has another. I know you had 2 last week.
Well, last week it was in the House.
Oh, you mean
and-
coming up on the floor? Okay,
Yes.
okay, yeah, so
Yeah.
it did come in the House last week. So you're saying
Right.
Wednesday's coming up on the floor?
Yes.
Yeah, I think the most rural water associations, if I remember, opposed that bill. I think they were opposing it because they said it was it's gonna cost a lot of money, that the water would have went up, which is, I mean, you shouldn't have a price on clean water. In his area, but specifically in North Louisiana, I think St. Joe's, they're having an issue, which really disturbs me. He said if you go to a hotel, it states the water is brown, but it's good to drink. You know, I'm like, no, and his argument was he thinks his community would pay whatever they had to have clear, clean drinking water, which is, I think we would too.
I think any community.
So I think they
would,
amended the
right.
bill to specifically help his area so that it don't impact everyone, but so far, I'm gonna knock on wood, I don't think we have issues with drinking brown water. But I don't think anyone should be forced. Yeah, you pay a water bill and your water is brown, no, that's not right these days.
We want to thank everyone for coming out this evening. We hope that this only starts your journey to help us and join the league with fighting for our rights as citizens. Since we've been around since 1920, we're strong here in Lafayette. We could use some more members if you want to be involved. We have some information in the back. We also have a flyer, Fix It, that Ms. Linda has provided to us. You know, she's very no-nonsense kind of speaker. She gets straight to the point, and we appreciate that. We love that she's a member of the league, and she's there for us at the legislature. Almost every day, she's updating us on all the bills. She had some more information she would like to share with you, but we are looking for members in the league, and if you enjoyed this discussion, come and join us with the league. You can get involved like that. I think I wanted to recommend to you at the Office of Public Health, because I've been where you are before, maybe some talking points on your card that you give, because a lot of people don't know how to address somebody that they see that's in a position of authority. And so sometimes they just need someone to direct them right. Give them the words to say, and then that would make it easier for them to call, to make that step. Ms. Linda, you have something you want?
I do have something. I'm with the St. Tammany League, although, like I said before, I'm all over the state. And the St. Tammany League has 3 of these left, and what these are is the advice, the guidebook to the legislature, and then you can look to see where these guys are working, where the districts are, their numbers. So if anybody's interested, I only have 3 left, and they're saying cash only $10. go to legislature, green card, you don't want it. I mean, green card, you want it. Red card, you don't want it. And this is just information card.
Thank you, Mr. Burton. Thank you, Ms. Hawkins. Thank you, Ms. Abear, and thank you, Representative Miller. And thanks everyone for coming.